So what do we do for SI joint dysfunction? Physical therapy, anti-inflammatories, all that, to get the joint moving, try to see if we can decrease some of that inflammation, strengthen the muscles around it. There's a lot of muscles and ligaments that you can't see here because this is just a bone here, but there's a lot of muscles and ligaments that come around here and stabilize this joint. And the anti-inflammatory medication will help decrease the inflammation actually inside the joint. If that doesn't work, the next step would be to do an SI joint injection. And in that injection, we put a needle, very simply, we come right across, go right past the ilium into the SI joint, and we'll put some steroids and some numbing medication into that joint. Now, if that works really well, but sometimes it could wear off, we can do something called an SI joint fusion. And we do these from the posterior aspect. There is a way to do it from the lateral aspect as well. A little more invasive, a little more risky, but posterior aspect is very less invasive, a lot less risky. We stay away from the nerves, stay away from all the blood vessels. The way we do this is patients lie on their belly, we make a small incision, and we drop straight down into the SI joint with a pin, and then we dilate, dilate, dilate until we have a working cannula about that wide. And then through that working cannula, we put a little dowel into that joint. And that dowel will be coated with some DBM or some bone marrow to help create a stabilization of this joint. So that's all we're trying to do with the SI joint is stabilize it.